Hey everybody, so this is pretty much the first time I've really made a video about my upcoming lower surgery, and I'm going to keep my voice down a little bit because Zane is asleep right now. I don't want to wake her up. So I wanted to touch on a few different points. This video might get a little long because I don't know when I'm going to have the chance to make another video. Time is hard to come by right now. So the first thing I wanted to talk about is why I chose the surgeon I did. I decided to go with Dr. Curtis Crane in San Francisco for my lower surgery. The reasons I chose Dr. Crane, I wanted to stay in the country and preferably as close to home as possible. When I had my top surgery, I did have complications the first go around, and I had a nipple infection and I had an adhesion, and it was really inconvenient because I was so far away from my surgeon, and so I ended up trying to take care of it myself. It got bad. I couldn't find anyone here that would deal with trans people. It was a fiasco. So I really wanted to be close to my surgeon, and I live about 6 hours from San Francisco, so that's the best I could do. So I definitely didn't want to be in Serbia, which was the other surgeon, where the other surgeon I was considering is. So I went with Dr. Crane in San Francisco. The other reason I went with Dr. Crane is because he is trained as a plastic surgeon and a urologist, and because I'm opting for the urethral hookup, I really wanted someone that had training with urinary tract areas specifically, and he's actually specifically done a ton of work with pediatric urethral issues, and with the size of things down there, that is right up the alley of trans men. So that's a reason I went with him. I also just liked the feel of him on the phone when I spoke with him, and I feel good about the feel of him as a person. The last reason I chose him is because aesthetically, the finished product of his surgeries are pleasing to me. I like what he does. I like how he fashions things down there. I like his technique for the scrotoplasty. I like how he fuses it down the middle, so it looks like two different ball sack areas. And I like how he tries to position things in a atomically correct male position rather than just leaving things where they are and shaping them. He tries to actually put them in a male position so they're out from between your legs, which I'm really looking forward to because I'm tired of it being between my legs. It's uncomfortable. So let's see, I think those are all the reasons I chose him. So that's why I chose the surgeon I did. The surgery I chose and why I chose it. I chose to have the metoidioplasty with urethral hookup, vaginectomy, and a scrotoplasty. So for those of you that don't know what all of those are, just a brief explanation. The vaginectomy is exactly what it sounds like. They remove the vagina and they sew it up. The scrotoplasty, they take the outer labia and they form it and fuse it into a scrotum. And the metoidioplasty, they take the clitoris, which has been greatly enlarged due to hormone replacement therapy, and they release it from the ligaments holding it back. They allow it to go into a free position, and then they take the inner labia and wrap around it. So it, when they're finished, is with the exception of ejaculation, a fully functioning phallus, small phallus. And the urethral hookup is, again, exactly what it sounds like. They reroute the urethra and lengthen it through your little phallus so you can urinate standing up. So that is the array of surgeries I've chosen to go with. My reasons for going with that surgery rather than a phalloplasty. And I'm not going to go into great detail as to what a phalloplasty is because that's not what I'm going in for. If you want to look up information on it, go ahead, just type it into Google, you'll get all the information you want. The reasons I'm not going to get a phalloplasty, first of all, and probably I don't want to say it's the biggest reason, the length of time for recovery, I don't have. Right now, I'm in a spot in my life where my income is the family income, and I don't have, and on top of that, we have a little one. I don't have the luxury of being down for the amount of time a person is down when they have a phalloplasty. The recovery is at least twice as long as the metoidioplasty, and I don't have that kind of time. Also, it costs significantly more than the metoidioplasty, and while I'm fortunate enough to have the money, though I wish I had the insurance instead, I don't want to spend it. I feel like I've spent a lot of money on my transition, and I feel like I'm ready to cap that. Also, the complication rate for phalloplasty, because it's more complicated and there's more stages, there's a higher complication rate. And I don't have the time or energy to deal with a higher complication rate. I'm really hoping to not have complications with my metoidioplasty, though there's a likelihood it'll happen. But I don't have the ability to deal with the complication. The final reason I'm not getting a well, I guess there's two more reasons. With the phalloplasty, I don't want to have a device implanted in me to get an erection. With the metoidioplasty, you get a natural erection. And the final reason I'm not getting a phalloplasty is because Tiff's done. She's nothing but supportive, but she's also done. She's grown tired of the surgeries, and I don't blame her. And it's not that it's been a gigantic load. It's been a couple weeks every time, but it's still stressful, and it carries a burden and a load for her. And I'm not going to ask her to go through a longer recovery than necessary or a more complex surgery than necessary just so I can have a larger penis. So at this point in my life, I can't justify a phalloplasty. I don't have a problem being a man with a small penis, because if you do research on metoidioplasties, for those of you that don't know, your phallus is pretty much going to be the size that you grew from your hormone therapy. So depending on who you are, you grow to anywhere between 1 and 3 inches. So I'm not going to go telling you exactly what I am, because there needs to be something left to the imagination. But most people grow between 1 and 3 inches. So that's what you're with. You're left with a phallus that, when flaccid, is long enough to urinate and function normally as a small penis. So those are the reasons I chose the surgeon I did, and the reason I chose the surgery I did. And then just one more thing I want to say about lower surgery. What I'm doing with lower surgery and the surgeon I chose isn't necessarily the right thing to do. Everybody's transition is different. Everybody wants different things from their transition. Everyone wants different things from their body. So for some people, they may be just fine keeping their original anatomy, and they don't lose any masculinity from keeping their original genitalia. The parts are not the man. It's just what you are willing to go through and what you want for yourself. Some people get the metoidioplasty and they're happy with that. Some people get phalloplasty, and that's what makes them happy. There's no right or wrong answer. There's no right or wrong way. It's just what's right for you and what will make you feel complete. So take those words to heart for those of you that are looking into lower surgery. Whatever feels good for you and right for you, that is the right thing for you to do. The best thing you could possibly do is do your research, find out exactly what you want, because there's so many different options for the lower surgeries. I'm doing the vaginectomy, scrotoplasty, urethral lengthening, and metoidioplasty, but you can get any mix and match of those items, and there's not really any going wrong. It's just what you want. So do your research and do your homework, and you'll be sure to end up with exactly what you want. Okay, so this is getting a bit lengthy, and my voice is kind of hurting from just spent half an hour singing Zane to sleep and then this talking, and I don't talk that much, so it's been quite a thing for my vocal cords. All right, so I will continue to update as things progress. My surgery's in April, so we have a few months, but I'm sure I'll be talking to you about it again. All right, everyone. Thanks. Bye.